Good morning, gang. Dr. Mankal here. Wanted to share a simple tip with you that I use on a regular basis because I get this concern all the time at the office. So part of my ritual in the morning is to get a little reading time in. I find that best time is in the morning, maybe after a workout, after some mobility work. So I don't sit in chairs too often. I prefer to sit on the floor. And for that reason is with some support and opening up my hips and pelvis, it's just a lot more comfortable to do. So I wanted to share that with you because I, like most of you, enjoy reading. I'm reading this book, The End of Alzheimer's, The First Program to Prevent and Reverse Cognitive Decline. It's a great book by Dr. Dale. So this is kind of how I do it. As you see, I've got a couch like everyone else. Very rarely sit in it. I like to sit back against it with my back supported, and I hope my legs out like in a V here. And you just get some stretching into the hamstring. A lot of you are very tight back into there. So I like to sit back and with the supported back there, legs straight out, and I kind of just bring up my book, and it's really comfortable to read this way. And because I'm creating mobility into my hip area in the pelvis, there's a lot less locking of my hip flexors after I try to get up after reading for a half hour to an hour. So this is one way to stay a little bit more comfortable, more limber, with some good support and reducing some of the stiffness and pain that you get in the hips and lower back. And I'll change up my position at times. I kind of go into the traditional, the figure four yoga type position. If you're too stiff, you can do one leg at a time. I'm not sure if you guys can see that. I'll try to angle the camera a little bit better. Bear with me here. So, one leg like this, one leg out. And then you just switch it up, right? Because some of you are not used to sitting on the floor like they do in some countries. Then this may be a bit challenging with you to start. But I encourage you to try it more often, especially if you are big into reading and optimizing your mind and learning something new all the time. So try this. Let me know how it goes for you. But making sure that you got some support and move the hips around a little bit to see what you can get comfortable. And you will probably realize after a few weeks of doing this, you'll tend to be more mobile around the pelvis and the hip area and have a lot less aggravation with some of your mobility and walking issues. So give it a try and let me know what you think of it. So that was my sort of tip of the day for your Friday. Have a great day, everyone, and we'll see you on the next one. Bye for now.